What is a hookworm? It is an endoparasite that lives in the small intestines of dogs, cats, and other animals. The Ankylostoma caninum is the dog hookworm, the Ankylostoma tubiforme is the feline hookworm, and the Ankylostoma brelonis is the canine and feline hookworm. Now that's all Latin fanfare. All you need to know is that they infect dogs and cats. The hookworm needs a warm, moist condition to survive, and it flourishes in tropical climates. That's why they can be very prevalent in Florida. The hookworm gets its name from the hook-like mouth part that lodges onto the intestinal wall and that it uses to feed and ingest nutrients from the host. As you can see here, is Mr. Wiggles. How do animals get hookworms? Animals can become infected by ingesting contaminated feces or dirt, by skin contact exposure with an infected area, where the infected larvae penetrate skin, or puppies and kittens ingesting milk from the infected mother, like you can see here from the dirt, licking, and from the mama. Where do hookworms live in the animals? The hookworms, once inside the host, will migrate extensively to the small intestine. Once there, the hookworms will feed on the intestinal wall, causing blood loss, which can lead to anemia. Animals may become susceptible to secondary infection due to the laceration and abrasions in the intestines caused by these worms. What these worms are actually doing is chewing on the inside of the intestine, nom, 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 creating these wounds. Egg, larva, adult are the stages. The adult lays the eggs. The host passes it in the feces. The eggs hatch. The soil is now contaminated. The larvae wait for a host, and the cycle continues. The life cycle of a hookworm is about 3 to 4 weeks. Can humans get hookworms? The answer is yes, absolutely. Although humans are not the definitive host for a hookworm, they can become infected by ingesting contaminated debris and or larval penetration through the skin. If skin penetration occurs in the human, the hookworm cannot migrate to the intestine as it would in other animals, but they can cause painful larval migraines that move in the skin, as you can see. And that's totally not what you want. If a human ingests the contaminated debris, the worm can migrate to the intestines and cause problems, like it could in a dog or a cat. Aww. What are the signs and symptoms of a hookworm infestation? You may see lethargy, weight loss, weakness, roughness and dullness of hair or fur coat, pale mucous membranes, anemia, diarrhea, dark tarry stools, potbelly, anorexia, and ultimately death, if infection is severe and left untreated. If infection is severe enough, a cough may be observed in the animal. He did not go good. How do I know if my animal has hookworms? Well, you can try to ask your pet, but I don't think that would work out. But a fecal examination is the best way to determine if your pet has hookworms. But if you suspect, especially if your pet has the signs and symptoms mentioned previously, bring to your local veterinarian as soon as possible. Bring your pet to the vet along with a fresh stool sample if possible. The stool sample is examined under the microscope and or by a fecal flotation to look for the hookworm eggs. Now, what is a fecal float? No, it's not a baby Ruth in a swimming pool. Fecal float is just a fancy term for getting the eggs to float to the top of the liquid so you can see them better using the microscope. What harm can hookworms cause? Hookworms can cause many problems to the host, like blood loss leading to anemia, secondary infection causing enteritis, and ultimately death. These parasites cause much pain and discomfort to the animal and puts much stress on their body. Oh, yeah, you don't feel good. Diarrhea. Good. How do I get rid of hookworms? Well, you could call in the Marines, but that's not really practical. There are many different ways, like drugs and medications available, such as fenbendazole, pyrantel, milbemycin, moxidectin, ivermectin, and many others. These drugs are found in products such as HeartGuard, Interceptor, TriHeart, Trifexis, and Sentinel. Some are prescribed by your veterinarian, or they can be found over the counter, such as Walmart, Tractor Supply, Pet Supermarket, etc. How to prevent getting hookworms? There are many ways to prevent your pet and you from getting hookworms. By living in a bubble. From getting hookworms by maintaining a clean environment, picking up your dog's poop, or you can teach your dog to pick up its own poop like this. That'd be awesome. Washing your hands, especially after playing with animals or after working outside. Keeping your animal away from unfamiliar areas where contamination may be possible. And maintaining your pet on a monthly preventative to reduce the risk of infection. Absolutely wear shoes when you go outside. Treatments and preventatives. Treatments given by the veterinarians can include HeartGuard, Trifexis, Sentinel, etc. But these treatments are only effective on the adult worms, so the doctor will retreat in 2 to 4 weeks to kill any remaining parasites that were not mature at the initial treatment. And of course, the best protection is always prevention. And one last thing, as summer's coming, make sure you wear sandals to the beach and lie on a beach towel. Hookworms love warm, moist, sandy environments. Thank you. I also have a couple handouts that I'd like to give